So this is our Hyperbaric update for the month of May 2025, and it's not too much. And the amount of literature coming out on this topic is not big, but it's important. The first is a case report looking at Doxorubicin, Extravasation, and Hyperbaric. So we have people who receive chemotherapy agents like Doxorubicin. It spills out and leaks into the tissue and causes damage. When it does, it's very painful. Here's a case report that shows us that you can actually use Hyperbaric to heal that faster. The next thing is something we've known for a while, just reframed. A lot of studies have been using hyperbaric oxygen therapy in inflammatory bowel disease. But here, this study looks at just using it for dysbiosis in general. Now, people who consume high carbohydrate diets, high protein, animal source diets, high amounts of fat, they usually have a dysbiosis, especially with ultra-processed foods. All these people, their dysbiosis can be improved because when you get that much oxygen, you get free radical formation that will go and destroy the harmful bacteria. A little bit different line of thought is hyperbaric improving male infertility, especially if the sperm counts are low. This can help improve the quality of the sperm and the counts. Another frequently reviewed topic here is radiation cystitis. So people have a prostate cancer they get radiation therapy for, but the bladder gets caught and irritated. And they often have bleeding with that. Now, hyperbaric oxygen therapy has been shown to be very useful in the acute phase, but this new study shows us even up to 5 years they can have symptom relief, which is very important to know because sometimes radiation can persist in the body for about 7 years. Something that we've been doing a lot of that we haven't published yet is hyperbaric oxygen therapy in skull-based osteomyelitis. This is usually with ENT and neurosurgeons who have to deal with these infections. Once a bone gets infected, it's a mess, and it's such a critical area. Hyperbaric oxygen therapy can fix that. It's also been shown to be useful in viral cystitis. So again, if the urinary bladder is infected by a virus and it's causing bleeding, hyperbaric oxygen therapy can help. To wrap up, we have 2 retractions. And what are retractions? They are when an article that's gone into publication has cleared a peer review, but is now withdrawn by the publisher, meaning, oops, we made a mistake. That's what this is. And there's 2 retractions that are looking at hyperbaric oxygen therapy for diabetic foot. Now, hyperbaric oxygen therapy is known to be very useful in the correct people with diabetic feet. And it works very well. There's no doubt about it. We have enough studies to show it. But there's been a recent trend over the past decade to try to show that it's useless. And many of these studies, especially something like the Damocles study from the Netherlands, is shown to be where hyperbaric is not as good as conventional care. Many times what these people are trying to do is generate a new statement so they can be published. Every time a study gets published, it should add new information to the existing body of knowledge. So if something is shown to work, the only way to get published is to show it doesn't work in this condition, that condition, these scenarios. Now, what we find a lot of happening is because hyperbaric is established for diabetic wounds, people come to say it's not. And when the methodology they've used is shown to be faulty, the study has to be retracted. Now, this is 2 retractions. These studies were likely against hyperbaric for diabetic foot, and this is the result they've faced. Poor methodology.